Before joining Digital Health Sales Institute, what was your biggest challenge or blind spot when it came to selling into healthcare provider organizations?
Yeah, the selling into healthcare provider organizations involves connecting with multiple personas across the organization, selling into them, more like customizing and speaking in their own words, and then closing the loop to close the sales cycle. It's a complex process, time consuming process. It's not one and done kind of process. So that's my learning.
What did digital health sales help you understand about how provider organizations actually make buying decisions?
Yeah, the provider organizations, when they are making buying decisions, they are looking for ROI. Is this tool optimizing my workflow? Is this tool saving my time as a provider? If they also look at the patient outcome improvements, like is this tool improving my patient outcomes in terms of the patient satisfaction, time savings for the patient, cost savings for the patient. So they look at all the ROI which they get from the tool and then make the decision. And is there a revenue generation path for the company which they are part of, like a health system they are part of? That's another consideration they have. So.
During your time with digital health services, is there a specific moment, session, guest speaker, or framework, or something cool?
Yeah, the CAP framework which Kurt taught was very methodical and systematic approach to sales. So, yeah, that was the best takeaway for me from the course overall.
How has digital health sales changed the way you prepare for a health system, provider group, or investor conversations?
Yeah, now I have realistic metrics and I have a method to the sales process in my pocket, which I can use with every sales conversation I have, as well as knowing the variety of avenues we can sell into is another thing. The FQHCs, health systems, provider groups, payers, paywiders, all these I learned from here. And for every conversation, the sales pitch has to be modified as per the seller. So that's the thing I learned from this. So.
What would you say to another digital health founder who has strong product but is struggling to get traction, move past pilots, or figure out who the real buyer is?
Yeah, so you have a pilot, you have the product. Those are like the first two steps you have. So if you have run the pilot, what are the improvements your pilot has proved? Look at that. And when you are having the next conversation in your sales pipeline, use them as the data-driven metrics to support your conversation. I have done XYZ with this hospital system. I proved the cost. I saved the cost for them. I saved this much time for them. Would you like to try this? I would ask.
If you had to describe the value of Digital Health Institute in one sentence, what would you say?
Yeah, it's years of experience. Someone is distilling into, I think 8 sessions is what we had. There is so much to learn, so much to receive, and I would say the first batch was in a very, I think we were blessed to be part of this cohort overall. So we learned a lot. Yeah, there's learning and implementing is on us. So that's the hardest part we have to do next is going out and selling. So.
Scan the QR code or click the link in the bio to join an information session to see if you are a fit for the world's first Digital Health Sales Institute.